Intracellular receptor. This is the structure of intracellular receptor. This is domain for the ligand. This is DNA binding site. This is Z finger. This DNA is protected by hormone response element, या heat shock protein. This is heat shock protein or hormone response element. So when ligand just like a steroid, for example steroid T3 T4 vitamin D, when this, let's suppose this is steroid bond here and forming steroid receptor complex. This steroid receptor complex internalizing into the nucleus, producing special mRNA, just like in previous lectures. This special mRNA having lot of activities, for example protein synthesis and even special protein genes expression suppression. It suppresses the special protein expression. For example, this special mRNA suppress the COX genes expression. So COX are not producing, not maturing, and this effect of steroid is responsible for analgesic, antipyretic and anti-inflammatory activity. We can explain this action by another way. This mRNA suppress the phospholipase A enzyme. This is the enzyme which converts phospholipid into arachidonic acid, and then arachidonic acid is converting into PG, prostaglandins, and this prostaglandin is responsible for pain, inflammation and pyrexia. But this signaling suppress this PLA, phospholipase A, as well as COX. So when both are suppressed, there is no conversion of phospholipid into arachidonic acid and no production of prostaglandins, and there is no pain, there is no pyrexia and there is no inflammation. This special mRNA can also alter or suppress the special protein. It can alter, change the special protein in the form of aquaporine. Now there is no aquaporine transplantation at cell membrane, and it creating oedematous condition, which is one of the side effects of steroid. These special mRNA altering are suppressing the glut protein formation. So now the glut are not transplanting, yeah, they are pseudo guts with transplant in the surface, and glucose is not internalizing and glucose stay in the blood circulation, which is known as diabetic condition. Similarly, you can apply with this mechanism lot of the side effect of steroid. Thank you for listening.